Hello, welcome back to my YouTube channel. I'm Trinity. I'm a year 4 nursing student, and today I'm going to be teaching you how to carry out Glasgow Coma Scale assessment for a patient. Let's dive into it. Firstly, what's the Glasgow Coma Scale? This is a scale that you carry out to assess a patient's level of consciousness. How conscious is your patient? How aware, how oriented is your patient? It's basically an assessment done to test the neurological functioning of a patient. That's what the Glasgow Coma Scale assessment is. So there are certain things I'll have you know before we properly dive into the assessments. The first is there are only 3 components. There's the eye opening, there's the verbal response, and there's the motor response. Each of those components have a certain number of marks they carry, or a certain score they carry. For the eye opening, it carries a maximum of 4 as a score. For the verbal response, it carries maximum of 5, and for the motor response, it carries maximum of 6. So for easy remembering, you can use the mnemonic EVM: E 4 as its maximum score, V 5 as its maximum score, and M 6 as its maximum score. The second thing I'll have you know is the Glasgow Coma Scale assessment. The minimum you can score a patient is 3. There's no 0. 3 is the minimum you can score a patient, and 15 is the maximum you can score a patient. The third is sometimes during assessments there is going to be need to apply pain stimulus to a patient. Sometimes for you to get a response, you're going to need to apply pain stimulus to a patient. So there are certain areas pain stimulus are applied. The first is central pain stimulus. For an example, the trapezius squeeze, supraorbital pressure. Those are central pain stimulus. Then the peripheral is a patient's nail bed. For the sake of this video, the supraorbital pressure, I don't really advise it because a patient could have head injury or could have facial fractures, and applying supraorbital pressure could aggravate the patient's situation. Also, another popular stimulus used during GCS assessment is sternal rub, when you apply pressure to the sternum. But it's been said that sternal rub can cause injury to underlying tissues, so the stimulus is also not advised. So for this video, we are going to be using the trapezius squeeze and the capillary nail bed. For the first component, which is eye opening, you can have a maximum score of 4. Depends on the action carried out. So the first action is spontaneous eye opening. For spontaneous eye opening, this just refers to when your patient is able to open their eyes without assistance spontaneously. For an example, you walk into a room and your patient opens his or her eyes and looks at you, observes you, how you walk to their bedside. That's spontaneous eye opening. So you assign a score of 4. Then the next action is response to speech. Eye opening to speech. So if your patient doesn't open their eye spontaneously, but you go to their bedside and you call out to them, for an example, you say, "Mr. Jones, good morning," and Mr. Jones opens his eye. That's eye opening to speech. So eye opening to speech, you're going to assign a score of 3. The next action is eye opening to pain. Yes, so if your patient doesn't open his or her eyes spontaneously or to speech, you apply pain stimulus. Remember, for this video, the pain stimulus is trapezius squeeze and pressure to the nail bed. So when you apply pain to your patient and your patient opens his or her eyes, because your patient opened his or her eyes to pain, you're going to assign a score of 2. If after all these actions carried out, your patient still doesn't open his or her eyes, then you apply a score. You give a score of 1. Remember, there's no 0. It's not possible for you to score a patient 0. Spontaneous opening 4, opening to speech 3, opening to pain 2, no response 1. There is no 0. Moving on, we have the verbal response. For the verbal response, remember from earlier introduction, the maximum score you can give for verbal response is 5. Or like eye opening, that is 4. Verbal response is 5. So for verbal response, the first action is orient. Orient is the first action, in the sense of you ask your patient certain questions of like, who they are, where they are, or certain things about them, and they are able to answer properly. They are oriented. You ask your patient, Mr. Jones, what's your name? And Mr. Jones says, my name is Mr. Jones, and his surname, that's correct. And you ask Mr. Jones, where are you? And Mr. Jones said, I'm in the hospital. That's correct. Perhaps your patient has a relative sitting beside him or her, and you ask the patient, who is this person? And Mr. Jones is able to say, that's my mother. That's correct. So your patient is oriented. So he's giving oriented verbal responses. So you're going to give a score of 5 because your patient is oriented. The next action under verbal response is confused words. Confused words. For confused words, your patient is speaking. Your patient is speaking, but your patient is giving confused answers. Your patient is making words that can be understood, but they are confused. I'm going to give you an example. For an example, you ask your patient, where are you? And your patient tells you they are in the gym. So when your patient gives responses that are confused, you're going to give your patient a score of 4 because your patient is giving confused answers. So confused words is the next action. After confused words, the next action is inappropriate words. Inappropriate. Remember, the first is oriented. The next action is confused. The third is inappropriate. Inappropriate refers to when your patient gives speech that does not concern or relate to the situation at all. For an example, you ask your patient for his or her name. For example, what's your name? And your patient says something like, give me food. These are inappropriate words. They have no business with the question you are even asking. So for inappropriate words, you're going to assign a score of 3 to your patients. The next action after inappropriate words is incomprehensible sounds. Incomprehensible sounds simply refer to when your patient cannot respond to you and your patient is moaning or groaning. Patient is having groans, your patient is groaning or moaning. You can't make out what your patient is saying because the sounds are incomprehensible. You're going to give a score of 2. If your patient gives no response at all, after all these actions that has been carried out, and your patient gives no response at all, then you're going to give a score of 1. Remember, there's no 0. It's not possible to score your patient 0. So let's go through verbal response again. For orient speech, you're going to give 5. For confused words, you're going to score 4. For inappropriate words, you're going to score 3. Incomprehensible sounds, you're going to score 2. No response at all, you're going to score 1. That's for the verbal components. Then the last but not the least, this part is a bit tricky, so you're going to follow me, is motor response. For motor response, the maximum number of score you can attain is 6. But before we go into motor response properly, I want to add that sometimes for verbal response, you have to ensure that your patient is also able to respond to you properly. Yes, your patient is able to respond to you properly. For an example, if you have a patient who has a tracheostomy tube will not allow your patient give adequate responses. Even if your patient's level of consciousness is good, because of the presence of the tracheostomy tube, your patient may not be able to speak properly. So you don't want to score your patient no response just because they couldn't say something. They probably can, but they have a tube sitting in place. So in situations like that, if there is the presence of something that may hinder your patient's ability to respond, you simply record it or document it as NT, not testable. NT, so it means you couldn't test it, not because you feel your patient can't respond, but because perhaps there's a presence of something. Maybe your patient is on a tracheostomy tube or even on oxygen therapy, and your patient may not be able to properly respond. You simply document it as not testable. Then we move on to motor response. For motor response, you can apportion a maximum score of 6 to your patient depending on the action. So the first action on that motor response is obey. Obey is really simple. You simply ask your patients to carry out certain motor functions like raise your hand or squeeze my finger, then let go, open your mouth, blink your eyes, turn your head sideways if they can. If your patient is able to carry out those motor functions, then you give them 6 because they are able to obey your command for motor functions you ask them to carry out. Then the next action after obey is localization of pain. Rather, this simply means that you apply a pain stimulus. For if you get there and you ask your patient to do something, like you're trying to get them to obey commands to motor responses and they can't raise your hand, they can't raise their hand, or turn your head sideways and they can't, then at this point in time you're going to have to apply a pain stimulus. So remember, our pain stimulus, you can apply a central one like the trapezius squeeze, or you can apply a peripheral one like the nail bed, pressure to the nail bed. So when you apply pain stimulus to your patients, if they're able to localize the pain in the sense of, for example, you squeeze your patient's trapezius and they're able to localize the pain, they're able to take their hand. When you squeeze the trapezius, they're able to take their hand and remove your hand, or try to remove your hand from the source of the pain. As you apply pain, they're able to use their hand to probably want to remove your hand from there. They are trying to localize the pain. Now, they couldn't obey, but they have been able to sense that pain is coming from this particular region and they want to remove the source of the pain. So that's localization. They are localizing the pain. So if your patient is able to do that, you're going to give your patient a score of 5 because they could localize the pain. The next action is withdrawal from pain. Withdrawal from pain, when you apply the pain stimulus and your patient cannot localize it, they obviously cannot remove your hand from the pain, but they try to move away from it. They try to shift away from the source of the pain. That's them trying to withdraw from the pain. Perhaps they want to pull their hand back, or they want to pull their shoulder away from you. That's withdrawal. So if a patient is able to withdraw from the pain, you're going to give your patient a score of 4 because they're able to withdraw from the pain. Then the next two are a bit complex, but they are easy. The next action is abnormal flexion. Abnormal flexion refers to when you apply pain to your patient's trapezius or your patient's nail bed. Abnormal flexion simply means your patient is going to curl their arm or their hand. Yes, their hand, their arm. Your patient is going to curl their arm inwards towards the midline of their body. Abnormal flexion simply shows that a part of the brain has been affected and it's causing abnormal response, because that's not a normal response to a pain stimulus. So that is abnormal flexion. So for abnormal flexion, you give your patient a score of 3. Then the next action is abnormal extension. For abnormal extension, your patient extends his or her arm and then moves it away from their body. Extends the arm, moves it away, and then internally rotates the arm. So the actions for abnormal flexion, your patient moves the hand towards the midline of the body and abnormally curls the fist or curls the wrist. For abnormal extension, your patient extends their arm, moves it away from the body, and then internally rotates it. So both responses, abnormal flexion and abnormal extension, shows that a part of the brain has been affected. So if your patient does abnormal extension, you're going to give your patient a score of 2. If there is no response at all, you apply pain stimulus and your patient does not still show any motor functioning at all, you give your patient a score of 1. Remember, there is no 0. So moving through the motor response again, if your patient is able to obey, you give your patient a score of 6. Then localization of the pain, 5. Withdrawal from the pain, 4. Abnormal flexion, 3. Abnormal extension, 2. No response at all, 1. So the total score of the GCS is calculated individually for a patient. So you calculate the score you got for eye opening, you add it to the one gotten for verbal response, you add it to the one gotten for motor response, and then you sum it up all together. I'm going to give you an example really quickly. If you assess your patient and your patient is able to spontaneously open their eye, that's 4, a score of 4 for the patient's eye opening. And then the patient is able to the patient for verbal response, eye opening, you've given the patient 4 already. Then for verbal response, let's say your patient is able to respond to you, but your patient is using confused words. So because your patient is using confused words, the confused word action under verbal response carries a mark of 4. So that's a 4 for the verbal response. Then let's say for motor response, your patient is able to withdraw from the pain. Withdrawal from pain gives your patient a score of 4 too. So for eye opening, your patient got 4. For confused words, your patient got 4. Then for withdrawal from the pain, your patient also got a 4. So this is 4 plus 4 plus 4, which is going to give you 12. So your patient score is 12/15. That's how the total score is gotten. So when you assess your patient, if you get a score range of 3 to 8, it means your patient's condition is severe and they maybe need to intubate your patient. If you get a score of 9 to 12, means your patient is moderate. 9 to 12 is moderate, so it's not too critical. At the same time, it still can be monitored for further progress. So 9 to 12 refers to moderate assessment or moderate neurological functioning rather. Then for 13 to 15 is mild, meaning the neurological assessment of your patient is good. Your patient can be monitored for further recovery or further progress. So 3 to 8 is severe, 9 to 12 is moderate, 13 to 15 is mild. And remember, for any reason or any situation you cannot assess a particular component of a patient, simply document as not testable. When you document, you want to ensure to indicate what kind of stimulus you applied or what command you gave in order to carry out the assessment for your patient. So this is how you can easily carry out assessments, Glasgow Coma Scale assessments of a patient in order to test for their LOC.